COVID-19 happened upon us and completely upended our way of life. I can't even say that it suddenly or unexpectedly appeared, as we had plenty of notice to prepare. Hindsight is always 20/20. There is no use crying over spilled milk or pondering on what we could have done or should have done differently. The fact of the matter is, COVID-19 is here, and though we have recently added several vaccines to our arsenal of weapons to combat it, it won't soon be gone. COVID-19 symptoms. Symptoms commonly seen with COVID include, but are not limited to, fever, cough, fatigue, muscle aches, headache, chest pain, runny nose, sore throat. Loss of smell and taste can also be seen early on. Signs and symptoms typically appear from 2 to 14 days after exposure. The above list is but a sampling of the signs and symptoms that may or may not be seen with this virus. How significantly one is affected varies from person to person. Some may be completely asymptomatic, while others may develop significant shortness of breath, which may, in turn, develop into pneumonia, requiring hospitalization and intubation. High-risk COVID-19 medical conditions. Those considered to be in a high-risk group are at an increased risk of morbidity and mortality. Medical conditions that qualify as high risk include, but are not limited to, pregnancy, heart disease, obesity, smoking, diabetes, any illness that compromises the immune system. COVID-19 is a respiratory-borne illness, i.e., it is spread through respiratory droplets that are released into the air when someone laughs, coughs, sneezes, breathes, or even sings. If you are in close contact with someone who has COVID-19 and any of the aforementioned occurs, you are at considerable risk of contracting the virus. Virus particles can also land on inanimate objects and be spread that way, specifically if you touch an infected surface and subsequently touch your mouth, nose, eyes, etc. Preventing spread of the virus. Prevention seems so simple, yet so difficult. Washing your hands with soap and water goes a long way toward preventing the spread of the virus. Wearing a mask not only protects you from getting the virus, but it also protects you from spreading the virus. Other ways to prevent spread include social distancing, keeping about 6 feet between yourself and others, avoiding crowded places or poorly ventilated spaces, covering your mouth and nose when coughing or sneezing. Either use a tissue or the inside of your elbow. Clean and disinfect frequently touched surfaces. If ever there was a time to be OCD, this is it. Make sure you clean light switches, doorknobs, tables, countertops, phones, faucets, etc. Be mindful of your own health. If you aren't feeling well, do not go to work or school. Vaccination for COVID. Whether it be patients calling the office and leaving messages via email, direct messaging, women specifically are asking, are these vaccines safe during pregnancy? Will they affect my fertility? Can I breastfeed and get these vaccines? Should I get one of these vaccines? I received my first dose of the Pfizer-BioNTech vaccine on December 22, 2020, and the second dose on January 13, 2021, 3 weeks after the first dose. Other than slight arm tenderness, I did not experience any significant side effects. Even after the second vaccination, nothing. I got the vaccination without reservation or hesitation. Why? Because I believe in science. I want to be safe, not only for myself and my family, but also for the colleagues and the women I care for on a daily basis. I haven't seen my parents, siblings, and dear friends for more than a year. Getting the vaccine brings me one step closer to seeing them. Another important reason I got the vaccine is to make a statement to my community, the African American community, which has disproportionately been on the short end when it comes to receiving comparable health care in comparison to other communities. For good reason. The African American community has had a lack of trust in the medical establishment. COVID-19 has significantly affected Black, Brown communities much more than others. I want these people, my people, to know that it's okay to get the vaccine and that it is a means to an end, not some experiment meant to harm us. Pregnancy, breastfeeding, and fertility. The American College of OBGYN does not recommend withholding the vaccines from women solely because of pregnancy, specifically if they meet criteria for vaccination based on the ACIP, Advisory Committee for Immunization Practices, priority groups. You can get the vaccine during pregnancy. If you happen to work or live in an environment with an increased risk of exposure, serious consideration should be given and a conversation should be had with your healthcare provider. Remember, whatever you decide is the right decision for you. If you do decide to get vaccinated, the recommendation is to wait until you have completed the first trimester of your pregnancy. The same applies to lactating women. They should be offered the vaccine the same as non-lactating women, if and when they meet the criteria for receipt of the vaccine based on the ACIP guidelines. Because the virus is composed of nanoparticles that are injected into the muscle and tend to stay in the muscle, they are unlikely to enter the breast milk. Hence, I say again, it is safe to get vaccinated if you are breastfeeding. And last but not least, fertility. The vaccine does not affect your fertility. Again, you decide if getting the vaccine is right for you. Your OBGYN, midwife, or nurse practitioner will be able to address any questions you may have about the vaccine and whether or not it's right for you. Thank you.